is Indian Country Today.
Esquili Yes'e. Thank you for joining us. I'm Patty Thalahungva. The Choctaw Nation in Oklahoma is just one of many businesses suing the insurance industry because their claims are being rejected. According to the Associated Press, the Choctaw Casino, along with millions of businesses, have had to close due to the novel coronavirus. They filed claims to recoup their losses. The president of the American Property Casualty Insurance Association says pandemic outbreaks are uninsured because they are uninsurable. The estimated monthly cost for loss of business is $300 billion. This number is many times higher than claims filed after 9/11. Now it's expected courtrooms will be filled with such lawsuits once they reopen after the pandemic. Massachusetts' two federally recognized tribes are getting support from Senators Elizabeth Warren and Edward Markey, along with state lawmakers. The president recently declared COVID-19 related emergencies for the Wampanoag tribe of Gayhead-Aquina and the Mashpee Wampanoag tribe. Now the group of lawmakers want the president to direct the Federal Emergency Management Agency to waive its cost share requirements for all COVID-19 related assistance to the tribes. In a letter they wrote, quote, "The response to the pandemic is unlike anything the Commonwealth or our nation has experienced in modern times, and the need for an additional resources to combat this crisis grows with each passing day." The two tribes had already sent letters to the president in early April requesting the waivers. Unlike states, the tribes do not have a tax base to cover the cost of services. This means they have not been able to put into place all the emergency services due to the high costs. Today's letter from the lawmakers reminded the president of the federal government's trust and treaty obligations that require tribal nations not be left to suffer severe hardship from an emergency. State and federally recognized tribes can now apply for grants from the National Congress of American Indians. The NCAI COVID-19 Response Fund is awarding $5,000 grants to tribes affected by the pandemic. All funds must be used within 6 months. The application is online, and grants are on a first-come, first-served basis. Illuminative is releasing today a humor-filled yet serious public service announcement featuring actors, artists, government leaders, and activists to remind Indian country to stay home together. In the video, Native actors say Indian people aren't listening to them, so they're bringing in some Hollywood heavyweights like Casey Affleck and Ed Helms and Wilmer Valderrama to get the message out, and then maybe Indian country will get the message. The group Harness partnered with Illuminative to create the PSAs. It's part of the Warrior Up campaign created by Illuminative. A virtual town hall about the impact the pandemic is having on Indian country is also planned for Thursday, April 30th. Taboo from the Black Eyed Peas will host it on his YouTube channel. Jordan Bennett Begay has the latest numbers of positive COVID tests in Indian country. Jordan?
Yate Patty, Yate Shikis Doshidine. So as of this morning, April 23rd, there are a total of 1,956 positive confirmed cases and 72 deaths within the Indian health system. Again, that is 1,956 total positive confirmed cases and 72 deaths. The Choctaw Nation reported a death within their tribal community yesterday, and the Navajo Nation, the Cherokee Nation, the Mandan Hidatsa Arikara, and Akewa Pueblo reported more cases within their communities. And these numbers are according to Indian Country Today's database. Indian Country Today is actively seeking out these cases from tribes themselves, as well as looking at the submissions on the Google form from individuals that can be found on the COVID-19 syllabus on our platform. And Indian Country Today also posts obituaries at no cost, as well as op-eds, just to put a face to these statistics and to these numbers that are coming up, because these individuals have stories to tell.
All right. And what are we working on with the rest of our crew from Indian Country today?
Yeah, so definitely we're looking at the lawsuits that's happening now between the tribes about the $8 billion disbursement. That conflict's going on with the Treasury Department. The question there to ask and the takeaway is how is the Treasury Department going to disperse this $8 billion to tribes right now? And that's still the question. And I think that's the big story we're looking at for now.
All right, Jordan Bennett Begay in Washington, thank you. And we'll be right back. Welcome back. Each day we report the number of deaths due to the COVID-19, and yet there are many people who survive this virus. Joining us today is Alastair Bitsóí, and he is a survivor of the coronavirus. Alastair, thank you for joining us.
Thank you for having me here, Patty, in Indian Country today, and I'm glad to be here to talk about my experience as a COVID-19 survivor.
Yes, and we are glad that you survived. We are glad that you're able to join us and tell us your story. You say that you went to New York and DC on a business trip, and perhaps that's where you picked up the virus.
Yes, perhaps exposure for me to have contracted the coronavirus, which causes COVID-19, happened in early March, earlier in the pandemic. And during the time, I was offering some media and cultural workshops in DC for my work, and then the weekend I spent in New York City, and I flew back to Utah. The travel dates were March 4th to the 8th. 3 days later, after landing in Salt Lake City, Utah, where I'm based, is where I experienced the onset of COVID-19 symptoms. I went about my routines, like going into my workspace and then interacting with colleagues and then going to the gym. And it wasn't until Wednesday, March 11th, that onset of symptoms such as experience of my throat. I had a dry throat, and then I kind of thought it was from my workout because I was exhausted as well. And then it went into, I just had low energy after that on that Wednesday. And then it just kind of had like a series of symptoms right after one another, which ranged from my body chills and body aches and fever, as well as a dry cough and a sensitivity in the chest. And so immediately I took the advice of a friend who's in physician assistant studies to break my fever. Even though my fever wasn't really high, I still had fever. And so I know that was critical to breaking the symptoms for me and to recover. It was a long recovery, or has been, but at least for the extreme components of this virus, like the 1 to 5 days, that was probably when I had the worst symptoms.
And you live in Salt Lake City, so you went to which healthcare center first?
I've had, in my story or my plight, in my situation with recovering with COVID-19, I had to overcome several barriers just to get tested. It wasn't until 13 days after onset of COVID-19 symptoms that I was able to get tested. And earlier in the pandemic, I didn't know, I was like most of everyone now, like freaking out, like frightened, like I didn't know, I was just trying to pinpoint exposure. And then what alarmed me earlier in the outbreak was when I came back to Utah and the Utah Jazz players had tested positive to shut down the NBA league or postpone the league. And then I'm from New Mexico originally, so I was monitoring outbreaks from New Mexico, and the outbreaks early in New Mexico were traced to New York. And so that's where I got alarmed, and I was like, all those two events were happening at the same time, and the epicenter was growing in New York at the time. And I think at the time when I was traveling, the Seattle Pacific Northwest was the outbreak epicenter. So all these movements were happening, and I just immediately followed CDC guidance and just quarantined myself, because I was like, well, based on these symptoms that CDC guidance is releasing at the moment, I think I could have COVID-19. And so I took all the precautions. I went and called the Utah hotline for COVID-19. That was the Wednesday before everything happened, the onset that night. And then the hotline referred me to Intermountain Healthcare Connect Care. It's a system that is used for telemedicine, and that was just a hurdle to get through because the Connect Care app was very overloaded, and I had to pay a copay twice, and it didn't really work out for me in that sense because of the overload, the demand, the lack of enough testing, the absence of enough laboratories doing the tests. And so that's what I know now. But when you're in the situation, it's alarming because the providers are looking at you like you're some alien, or like they don't know what to do either on their end. And so through Connect Care, I paid for a copay twice and never really got seen from a telemedicine provider. That was Wednesday, Thursday. So experiencing those experiences, I called the Go Shoot clinic here, Sacred Circle Healthcare, and they told me that they're referring all patients to Intermountain facility in Murray, Utah, which is the headquarters of the healthcare system for Intermountain Healthcare. And so I went there because the next day on a Thursday, I was still the same. I was like worse. And I feel like that's where my sensitivity and chest and dry cough was more consistent. And so I kept taking Tylenol every 6 hours as prescribed, and also relied on Pedialyte and Mucinex as Western over-the-counter remedies. And so on that Thursday, day 2 of onset of symptoms, I essentially was like, I'm not feeling better at all. Like I'm not improving. And so I took the guidance, and I was frustrated. I was cursing around. I was just like, how can a person get through this if they're experiencing this? And it's a pandemic. The WHO just issued that. And so I was just like all like angry, like upset, like all these range of emotions because I was denied healthcare. But also because I pay for healthcare through my work. And so that's why I was like, I should have an advantage in this case. And so it was just really frustrating. But that Thursday, I just I overcame my lack of energy and drove to Murray from Salt Lake City, which is like a 15-minute drive. And I went to the front desk, the huge facility. And then they were like, you got to go to the OR. So I drove around, checked myself in. I told them I'm presenting with COVID-19 symptoms. And I, based on the CDC guidance at the time, I was like, I was in a travel zone, which is New York, DC. And I have the COVID symptoms as according to the CDC. So they processed me through. And then when I went into the ER room, the providers came in and they did the vitals. And that's where all this thing, like all these barriers I had to overcome in the room. And the pandemic, of course, the media at this time is like blowing it all up. Like it's moving. It's like, these are the hot zones. These are the epicenters. Like, be careful. So all this new guidance was coming out as the pandemic was moving across the country. And so when I was in the ER room, I finally got seen, and the provider there, one of the first things is like, we presume that you have COVID-19, but we can't test you. And the reason why we can't test you is because the health department won't let me. And so behind the scenes, when I was in the room, the CDC and the Utah Health Department and the healthcare providers at the facility were trying to collaborate and figure out what to do with me, because my symptoms, even though they were mild, I feel like even though they were mild, they were still severe. And they were like, you have mild symptoms, and even if you were tested, you would still go home anyway and quarantine or self-isolate. And so I was just like annoyed with that, because I'm like, clearly in the emergency room, and clearly I'm sick, and clearly I have a fever, and clearly I have all these symptoms. And so I was just like annoyed with it all. And so I said, okay, well, maybe if I have allergies. And they're like, no, you don't have allergies because you have a fever. And I said, well, if you're saying I have COVID-19 but won't test me, but you're saying that I don't have a fever, like how do I even like know what I have? And I said, maybe I have the flu. And they're like, yeah, you could have the flu. So I had to plead for the test for the flu. And I eventually got the test, and I tested negative for flu A and B. So that just showed me again, okay, well, clearly I don't have the flu, and it's just narrowing down to COVID-19. And then.
So did you go home then at that point?
No. I was still going through this whole process, and it wasn't until I got the results back and I was released. And then another provider team came in and told me the same thing. They're like,
you got the results back from the flu test?
Right, the flu test.
Okay.
And that was negative. So then that's when I was like, well, clearly I don't have the flu or allergies, and I have to have COVID. And so in the end, though, they just released me and they said, you have to isolate and we won't just do that. So if I wouldn't advocate for myself to get tested, I don't think I would have been traced in the system. I would have been an I guess, underreported case in the whole pandemic. And so what happened was that I essentially got recommendation that I had bronchitis, a viral bronchitis. So I left that room with no diagnosis. So that still bothered me. And then on the end, I got in contact with the creator of the Connect Care app. And they just told me to lie about your symptoms, lie about like shortness of breath so you can get tested. Because at the point in time, there was a demand for tests. And at that point, I just broke down. That was my first breakdown through this whole process. And I called the University of Utah Health to get through, and I told them my plight at Intermountain Healthcare, and they were like, you should never be denied healthcare. But in that setting, I said, healthcare is a human right. Like everyone should have access to that. And then that's one of the providers told me, like, not in America. So that didn't help. That didn't help all these things going through my mind at the time. And day 3, I didn't get tested. I went back to my room, my apartment, and day 3 came, and Utah University of Health also said the same thing. I can't test because CDC guidance had changed over those 3 last days. And they were like, you weren't exposed to a known COVID-19 case. So that's where I was not allowed testing.
You didn't have any known direct contact with someone.
Right. And then I was afraid because I was in New York City. There's lots of COVID-19 exposures and cases there. So I was just like annoyed by that again. So those were barriers I had to face. And then as the guidance, and so I just kind of relied on over-the-counter remedies. And then that's when I started to alert family and friends, like, hey, I possibly have COVID, like I'm staying here. And my family was begging me to come back to Navajo, but I was like, no, I don't want to be a cause for community spread. I don't want to expose you all. Like, I care for you and I love you all. And at the same time, even though I was going through that, I still got reprimands. I still got told, like, you don't listen. That's why you should go home, like stay home, don't travel, like all these things. And I was just like, you guys don't understand what I'm going through here. Like, I'm trying to navigate the healthcare system, also trying to survive, and then living by myself and trying to sustain myself through this whole course of this virus. And luckily I had friends and colleagues that are loving, endearing, and they provided food drop-offs. And so I really want to thank them and appreciate them for their efforts, and including like bringing sage and juniper for me to recover from, like cedar. I also had some of those remedies that I know, and I've had them in my little medicine cabinet. And so I relied, I think, heavily that helped me recover. And it wasn't until like day 13 that I finally got tested for COVID-19 as the guidelines and testing became more available and the laboratories became more available and the tests became more sensitive and reliable, that I got tested for COVID-19 through the University of Utah healthcare system. I went through the drive-through. I did the nose thingy, and that was on a Monday. I think it was March 23rd. The 24th, the next day, they told me I was COVID-19 positive. At that point, my symptoms were still a dry cough and sensitivity of the chest. In addition to that, I, along with other Salt Lake City residents, we had to deal with earthquakes here. So that was another factor.
So you're sick,
yeah.
You're in pain, you're already in fear, and then the earthquake hits.
Mm-hmm.
And that was a huge earthquake.
Right. It was a 5.7. And I was laying there one morning on a Wednesday, and I was like, it woke me up. And I was just like how do I don't know what to do. And so like I wrote it out. But I was just like, this is crazy. We're in a pandemic. Earthquakes are happening. Like, so those more fears enhance more, of course. And then you have pre-Easter holidays. So, like there's that.
And have you ever been in an earthquake before?
No, never. So I had to navigate and figure out, is this an earthquake? Like, is this what it feels like? So like the novel coronavirus and the earthquake, I had to figure out, like, this is real. This is what I'm experiencing. And so since now to then, I've experienced 3 other aftershocks. that are like around 4.2. So those are things that I'm battling in my recovery journey, recovery with COVID-19. And that's kind of why I wanted to share my story. And I shared it through a Instagram post that I felt needed to be amplified because of sensitivities around the virus and stigma around the virus. And I thought it would be nice to not be like to celebrate my recovery, given how a lot of news stories focus on the mortality rates or incident cases. And so that's kind of why I was like, well, we can, Indian country, Native people are strong and resilient people. And yes, we'll lose some casualties to this virus, but we will also gain some strength from it. And that's more or less the reason why I wanted to share my story.
And it's quite the story. And again, you were fortunate in that you didn't have to be hospitalized, and so you don't have that experience. But there are a lot of people who are home dealing with this. Go through your symptoms again, because one of the things that we're hearing is that people tend to lose their sense of smell and their sense of taste. Did that happen to you?
Yeah, when I reflect on this, I think I really did have that, because when I was going through it, that was a new symptom discovery of smell and taste. So when I was going through it all, I didn't really care to look for that, because I think the virus that I experienced had a combination of allergies as well. So I was stuffy, I was sneezing, I was coughing. So that did not help either. So again, my symptoms that I had from onset were fever, body chills, throat. Like I kind of like thought it was the stomach flu. Normally when I get sick, I can bounce back easily from the stomach flu. And later on, I was actually throwing up, and I had a little bit of diarrhea later on after like maybe day 13. And that's when I told the provider who cleared me for the order to get tested that I have diarrhea today, even though it's like almost out of the incubation period. And so that cleared me as well. And unfortunately, I think I had shortness of breath, but I wasn't really monitoring. I think my main concern was the literature that was coming out was saying how people can experience decrease in lung capacity and organs shutting down. So the anxiety of the media, reading those stories, and I'm engaged with media because I work with media a lot, and I was a former reporter. So I try to skim through articles and figure out like, okay, what's the best like evidence-based like symptom or literature out there. And so I try not to read into the media hype either, because I don't want my mind to run away with that either.
Well, so, part of it is that this virus is new and it's changing, and we're learning more and more about it. And so, as you mentioned, CDC guidelines are also changing. Yeah. And there's that real push to test everyone, to see perhaps who's already had it, to see who maybe has it currently and is not presenting any kind of symptoms. And that's the big danger now. And that's why there's that big push for people to stay at home. And that was, something that you were trying to express to your family. You don't want to come home. As much as they want to take care of you, you don't want to come home because you could potentially expose the whole family. How is that now with your family? Are they understanding more?
I think they're more understanding now. And then that was my concern. I didn't want to be the cause for community spread. Already and just seeing the incident cases growing in and around Native country, particularly on the Navajo Nation where I'm from, the virus spread from off Navajo into social gatherings, and it spread. And I get really triggered and frustrated with family and relatives, like, stay home. Like, there's multi-generational like household, like it'll easily spread. And so for me, I still have anxiety over family, even though I survive. Like over here, I'm just like freaking out. Like, I hope they minimize their exposure. I hope they're not going to border towns. I hope they're following orders. I hope they're getting along with each other. Hopefully they're not getting on each other's nerves. Like, those are things I'm processing over here. And I'm like, stick together, stay home, like don't visit each other. I know you guys are used to visiting each other. So, and then I get frustrated because I'm like, am I not enough as a case to show you like how severe this case is, like this virus? Like, so that's what I get frustrated. And of course there is the stigma of the virus. Like, I know there's misunderstanding of me being publicly advocating for my survivor, because I've heard that I'm trying to use this opportunity to gain fame, which I think is funny because I'm like, that's not who I am. I'm trying to help people understand the need to follow CDC guidance as best as you can, the tribal public health orders, the need to stay home and shelter in place. And so like I've even as a survivor, I've had pushback. And I'm like, I'm the one over here like trying to help over here.
Yeah.
So that's
well, we're by sharing your story. That's what we also hope to give information to Indian country. Alastair Bitsóí, thank you so much for joining us today.
Yeah, thank you. Bye.
And we're happy you're safe. Well, thank you for joining us, and we will be back tomorrow with our Reporters Roundtable on our newscast. So take care of yourself. Take care of yourself. Your life is precious. I'm Patty Thalahungva. Thanks for joining us.
This is Indian Country Today.